you all for joining us for the October Overview and Scrutiny Committee. It is 6:30, so we are starting. Can I welcome you all to this meeting? At the present this meeting are members of the Overview and Scrutiny Committee, co-operative members and members of the Harrow Youth Parliament. Also present, leader of the council, the portfolio holder for finance, portfolio holder for environment, and council officers. I believe Tracy and Lawrence, also from HR and public health, are joining us for a first time at Overview and Scrutiny. So welcome to you. The chief executive has sent his apologies. He's unavoidably unable to make the meeting today, but has very kindly offered to meet with myself and the vice chair after the meeting if there is anything we need to follow up on. Just a reminder in terms of virtual meeting, members of the committee, except co-op members and Harrow Youth Parliament, should have your videos on at all time, but your microphones on mute unless you're speaking. Other members, other members can keep your video cameras off and muted, and then turn it back on when you need to speak. If technical problems persist or we become inquirate, the meeting will be abandoned and rearranged for another date, or ideally we will solve the technical problems. This meeting is being video and audio recorded and will be available to watch and listen on the website. It is being live streamed at the moment. If you do want to get my attention, you can use the chat option on this. You can use the hand up option on Teams, or you can wave frantically at your screen and I will spot you. Okay, so that, and also a reminder that if you have a mobile phone or anything else, if you can put that to silent just while the meeting is ongoing. Move to item 1 on the agenda, is attendance by reserve members. Are there any reserve members? Sassy, do you want to unmute yourself and say who you're reserving for? Sassy, are you hearing us? So we got, so your IT was working a couple of minutes ago.
Right. Yeah, it's now. Hello. I'm Councillor Sassy Suresh, reserving for Councillor Sarah Butterworth.
Great. Are there any other reserve members? I'm not aware of any, and I can't see anyone putting their hands up. Fine. Declarations of interest. These have been published. If there are any interests members of the committee have that haven't made it onto the published agenda, please let me know now. Can't see any. Okay, item 3 is minutes of the last 3 meetings. We have a variety of meetings, minutes of meetings since June, 2nd of June, 7th of July and 1st of September. Are there any comments? Jeff? And then Stephen.
Right, I think there's a slight error in the minutes of the 2nd of June. As far as I can recall, it was obviously a little while ago, I said that I had an interest in that I was receiving services from the government, but not the council, and it's come out as receiving services from the council. So if we could just make that alteration.
Okay, yep, I'm sure that can be made. Stephen.
Thank you very much, Chairman. It's more of a matter arising. It's in relation to the minutes of the previous meeting where we discussed the strategic development partnership. When that meeting was reported to Cabinet, I think it might have been suggested, not in the minutes, but in the presentation, I think it might have been suggested that the committee would be in favour of the council buying but buying the affordable homes of any new scheme to use as council homes. I know that's something that you're in favour of, Chair. I don't think we as a committee have expressed a view either way, to be honest. So I just wanted to make sure it's noted in these minutes, just to make sure everyone's clear that it's not something that the committee as a whole has expressed a view on one way or the other.
Yes, absolutely. I certainly reported that we discussed it at the committee, and I support it. But yeah, we can make it clear that the committee itself didn't have a specific vote on that. That is fair to have that noted.
Thanks. Thank you.
Okay, other than that, we can move on to item 4, which is public questions. None have been received. Petitions. Are there any petitions from members of the committee? No. Any from any other people that can speak? Is there any petitions? Nope. Okay. Item 6, references from council and cabinet. None have been received. So we move on to item 7, which is which we're going to have an agenda, which we're going to have a presentation on, which is a Q&A session with the leader of the council. We also have Councillor Adam Swirsky, the cabinet member responsible for COVID, with us as well to ask any questions. And Alex is going to provide us with a presentation which has been circulated in advance. She's going to share with us. The first 4 slides are broadly an update, given the number of items we are dealing with. I've asked Alex to skip through those quite quickly and move to slide 5, which has more substantive information. Alex, over to you.
Thank you very much, Chair. So on the basis of that, I will probably skip through this update on the basis that it's been circulated in advance, and also this is broadly the same presentation that the Chief Executive gave to Cabinet on the 8th of October. So in effect, the strategic overview is that it is getting worse, and obviously, as we saw going into the weekend, London became tier 2 as of midnight on Friday of last week. The council is obviously trying to deal with the joint challenge of having to keep most of, or not, if not all of its services open and continuing, as well as devising and managing and delivering a number of other responsibilities, and some of which are new services, which we'll go into in more detail in the slides. So I think it's fair to say, in terms of our immediate response, one of the things that we are trying to do is make sure that we do everything in a COVID secure way. Our communications is both general and specific, targeted to where we think it will have the biggest impact locally. And obviously we have gone on both an educative and an enforcement focus for businesses and local people in order to, again, maintain safeness as far as we can within the borough. And obviously we've got elements of support around test and trace, which, if needs be, Lawrence will be able to go into in a bit more detail if there are questions on that. And obviously the last bullet there is around the implementation of the quarantine payments. But I think in terms of starting on one of the main slides for this evening, I go into more detail in these slides in 6, 7, 8 and 9. So to some extent, I can just land on this page and then run to slide 10 and 11 and 12 afterwards, Chair, if that's more helpful. So in effect, we've broadly broken down our service response to COVID into 4 pillars. Part of this is around the essential services that we're going to have to require to keep going and may require additional support. And some of this comes in the context of what we do. If, for instance, we've got to have a number of staff self-isolating because of COVID outbreaks, either in the workplace or in their own home environments, especially in services where actually they are unable to do their jobs or their roles when working from home or working remotely. We've identified leads for all of the tasks, as you can see on this page, on the basis that we need to make sure that there is a clear line of sight and accountability for the work that we need to do. So that first pillar is around our essential services and the things that may get more challenging, but ensuring that we've understood what the resource requirements and the resource needs are. The next one is around existing COVID-19 services that may require additional support. So, for instance, we've had a local test centre that we've got set up, which is a walk-in centre in South Harrow. I know that we've had people going around the borough looking at numerous sites for an additional capacity today, so that continues, and we'll obviously need to bring more testing capacity into the borough. PPE will continue, as will our HR support, although that will become more challenging as we go into darker evenings and the winter months, on the basis that we need to be prepared for this for at least a 6-month period. Enforcement and COVID marshals just covered to some extent in the previous slide around what we need to do on that. And obviously, it's our communications engagement is an important element of all of this. The new and enhanced resident and business support areas cover the things which are new from the first wave. So things like our local track and trace, how we connect in with our broader access Harrow and customer services in terms of what we were doing previously around just the community hub and outbound calling. We have to integrate contacts a lot more in this. There's obviously the self-isolation payments that we need to be able to administer and support residents if they have to go into self-isolation. And again, we've got things like member and staff flu jabs on the basis that we need to be in a position to be able to ensure that we minimise the risk to everybody of what might be the impact of this second wave. And then the reviews pillar broadly is things around ensuring that we create the capacity where we need it, and also we keep our services safe and continue to understand, you know, where we could actually review something to actually, you know, reduce some of its needs. But again, this will be continually under review, and I think the Chief Executive's email last night as well covered the fact that we will be giving an update at November Cabinet on this, and obviously very happy to come through to Scrutiny again to give an update and make sure that you feel that the things that we're putting in place as an organisation are what is needed and what is required. So in the interest of time and allowing yourselves to ask more questions, and the fact that the slides went out in advance, I will jump to the strategic response slide. So as I said just earlier, we're expecting this as a 6 months minimum. So in terms of our planning and our mindset for this, we are expecting this to go to March, April time of next year. We expect this to get worse before it gets better, especially as we're going into winter pressures with the NHS locally, and what we know is likely to be things from previous winters around the pressure on services. And the fact that lockdown measures may get worse, as we're seeing in terms of, you know, organisations move up the tier structure at the moment, or I should say boroughs and areas move up the tier structure rather than they move back down at this moment in time. We're obviously running an emergency response as keeping many of our services open, and obviously that requires us to do some prioritisation, of which CSB, the Council's Corporate Management Board, will be looking in detail at, or starting its discussions to look in detail of that tomorrow. This obviously links in with a number of other strategic priorities, which again we can cover more on the borough plan discussions later if needs be. But there are a number of other things which the council has started endeavours towards, which we would want to maintain progress and want to maintain momentum. So HSDP was signed off in terms of the appointment of weights in September. There is a lot of work to try and move ourselves towards that, and that drives a number of objectives. There's wider regeneration work. There's obviously our potential move to forward drive as well. We have to set a balanced budget next year. We're legally required to do that, so we have to maintain our financial work as well, led by Dawn. And also on the borough plan, we need to be demonstrating that we are not only delivering against those priorities, but we're also building towards the overall objective over the 10-year borough plan. And then GLA elections are not expected to shift next year, so we need to plan for an election in all contexts, including what happens in an actual live pandemic. And then moving on to the other side of the slide, we've got the Black Lives Matter and Equalities agenda, which we've got a report on, or a set of slides on, an item on this evening. And there's a whole host of things around modernisation the organisation is doing, all of which contributes to a better, modern and more productive organisation. Council's committed on a climate emergency and also on health and social care integration. That is a big thing that we've made major strides on during the pandemic with health partners, but again is something that we need to try and keep the progress towards. So just in terms of the final slide, obviously, you know, these were the chief executive slides, and you know, I would obviously concur with the first bullet there. I think the organisation has done an incredible job and we've seen incredible endeavour, incredible people going the extra mile during the first wave. But this will now move into a more challenging period because people are tired still and they are fatigued around COVID. And we're obviously moving into a more difficult time of the year, given the darker evenings, colder weather, etc. It's complex. We've got a number of things that we need to try and keep up in the air at the same time. And a major issue, which I know Sean would push if he were here, is the genuine concern around our organisational personal capacity and resilience as an organisation, which is why the prioritisation work is so important. So this will require some decisions and maybe some difficult decisions around where our priorities and expectations are as this second wave intensifies. And obviously, you know, through the democratic process, we'll keep these under review and make sure that reporting through to yourselves as scrutiny and any decisions that the Cabinet are required to have oversight of will be maintained throughout all of this. So I will pause there. Hopefully I've done that within 10 minutes, Chair. I'm sure if I hadn't, you'd have let me know. So I'm assuming that I have, and therefore I don't know if Graham or Adam wish to add anything, but I'll take the slides down now in order for everybody to see one another.
Thank you, Alex. Yes, you were well inside your 10 minutes, so thank you very much. And what I should have also said before we start in this is to all items on the agenda, the fact that we've got presentations rather than reports today is the Overview and Scrutiny Committee doing its bit to help reduce the pressure on officers by not making them write long reports. So that is why we are a presentation-based meeting today, and more likely to have large presentations future as well.
And we're very grateful for that, Chair.
I'm glad that's the case. Right, I'm going to open up to questions. Actually, in fact, we'll bring in Graham as the leader of the council to add anything he needs to know. Graham.
I just want to add 2 or 3 minutes worth, really. I think when this presentation first went to Cabinet meeting on the 8th of October, and at that time we were recording 78.4 cases per 100,000 residents, and we were assuming that if we did move to phase 2, it would probably be tier 2, sorry, it would probably be sometime this week. But the rate started escalating very quickly, and as you've seen, as the 15th of October, it's 121 per 100,000 in Harrow. West London, East London, North London are being hit quite significantly hard, and now the London average has moved from the 96 last week to over 100 per 100,000 over the whole of London now. So some boroughs in the southeast, or sorry, southwest, are actually lower than 100. So this shows how quickly this is travelling, this virus. I'm not going to go through the points that Alex has raised already, but there was just a few things. It's a fact that people can get both COVID and winter flu at the same time, and that's what's going to cause a problem as we move in through November and December. And while we're trying part of all our COVID presentations and communications, we're also mentioning around the flu vaccine. We're trying to get that pushed as hard as we can to try and mitigate against that risk. But I'll go back really to Alex's key points and the slides with the many columns on. I think we learned a lot through the first phase of COVID. It stepped up a large number of new services in a way that has never been done before. And we've now got online meetings. I think we're in a good place to sort of take on the second phase in that sense. But the trouble is, a lot of staff haven't sort of stopped from the first phase. We've been travelling through, so they've been sort of full on since beginning of March and still continuing, and we can't see an end of it until end of March next year. You've probably seen in the news tonight that Manchester is going to move to tier 3 on Friday. And Wales are doing their own thing about locking places down, which is higher rates. So unless we can control the infection rate across London, and I say we because there's quite a few partners involved with this, everyone's got to play a part. Unless we can get that infection rate down, we're likely to move into tier 3 as well. The problem is with that, you never know when you're going to get out of it, and there's really harsh restrictions involved. The rest of it, session, I'll leave to questions, and I can answer any specific points.
Great, thank you. I see Stephen. I'll bring Stephen in first.
Thank you very much, Chairman, and also thank you from myself as well to all the staff and all the work that is being done. It is appreciated. Just wanted to ask about, just really picking up on the leader's final point, really about what might happen in the future with moving between different levels and different restrictions and so on. Obviously, when the decision was made to increase to tier 2, that was done on a whole London basis, and I think, if I'm right, that's something that that our borough supported. If we're in a situation where, which we hope we don't find ourselves in, but if we're in a situation where tier 3 is being discussed for London, would the same approach be taken, that we would seek to move as London as a whole? Or if the situation changes and say we're not in the same position as other areas of London, and other areas of London might need to move to tier 3 but we might not need to, would we still seek to move with the rest of London, or would we seek a differentiated approach?
I can pick that part up. This was devolved down to boroughs, part of the transition arrangements for COVID, where you've seen sort of borough leaders are sort of having that conversation with the minister to say whether you move into tier 2 or tier 3. We agreed some time ago across the 33 councils of London that it makes it much better and easier to control if it was the whole of the city, because otherwise you lose it in your communications. You could say Harrow moves into tier 3 but Barnet isn't, but how do you explain that to the Romanian community that's split by the A5? So we'd rather have that sort of commitment. 32 London boroughs are still proceeding with that proposal, although one London borough is sort of on the south side with, I don't think they're in London really, but they, their numbers are lower, so they're sort of coming up with a different viewpoint. But even those boroughs that it isn't affecting that much, at the time when we made this decision, Barking and Dagenham were probably well over 100, and so was Redbridge. Harrow was sitting just above 60, but it makes common sense that we have a commonality across our communications in the whole of London. The challenge is going to be is how do we get out of it, because there is not that financial support we had in the first wave, where you had the proper furlough schemes in place, the business grants and everything else that's there. And that's what's going to hold us back from actually delivering a tier 3 if we get to that, the infection gets to that level.
Okay, thank you. I think if we, obviously we hope we don't have to get to a situation where we move to tier 3, but if we did, I think there'll probably be quite a lot of scrutiny of the various different levels around London to see what needs to move where. But I do take the point you've made. If we needed to move, if we did need to move to tier 3, or even say another lockdown or something like that, what impact are we expecting on the council services to be? What are we planning for in terms of new things that the council might have to do? Prioritisation was mentioned. What services are we expecting to have to prioritise and not prioritise?
If I answer first, then Alex will come back to the slide deck where you got the 4 columns. It's an important point in the fact that at the moment we're just trying to guide people in the right direction, so we're not enforcing as much as other places are. So Barking and Dagenham have had to take enforcement notices out against some businesses there. We don't really want to get into that space at this moment in time. We want to take people with us and sort of keep everything moving forwards. If we moved into tier 3 and businesses started to close, then some might ignore the guidance, then we'd have to take enforcement notice. But that's a lot of this enforcement is done through the policing rather than through our enforcement team itself. I think longer term, and the fear of it is the economic impact it will have across our small business community. it have a major impact across our zero-hour contracts and sort of low-paid workers who would sort of be out of work straight away, and that's why we want some enhancements around the sort of furlough schemes. But within the council itself, we're gearing up into some aspects. So we're gearing up to an impact around adult social care, which is a priority. We've also, and Alex can go into detail, we've been extended to the community sort of food banks level to make sure there's some resilience in that to get us through right through to March next year. But on services themselves, it means some closing down, but we don't know which ones we're going to close down at this moment in time. That's why Alex was saying we've just got to work out what our priorities are as we get into that situation. We've been on just over 100 on London. We'd have to double over twice to get to the level of a tier 3 at the Manchester level, but that could be about 5-6 weeks away.
Alex, did you want to come in to add a bit more?
Sure. If I can, I will just try to share the that previous slide. So just to answer your point, Stephen, I think the challenge here is that all of these things, we don't necessarily have that much choice about whether or not we deliver them, but what we've got to try and do is deliver them within the financial capacity that the organisation has and the staff capacity that the organisation has, and keep a motivated staff workforce going throughout all of this. Some of these we can deliver in a more innovative way with partners. However, that requires having the brain space and the strategic space to be able to plan and change and make those improvements, all at the same time with an expectation of having to be, delivering these things at the same time. So this is where I think when the Chief Executive presented to Cabinet in October, clear around the fact that there is a need for the organisation to really get into the detail of this, to understand what it actually has the capacity and capability to deliver. And I think it's fair to say that we don't know what the answer to that is. Officers are working through that, and we'll start part of that discussion at the corporate management team tomorrow. The challenge is one where ultimately we've got to try and make this fit. So there's a question of what gives if we're able to deliver as many of these things to the level of quality that we need to do that our residents would expect. So I don't think there's a magic bullet answer to this. And on that basis, funding does come into it, but at the same time, there's only so much funding can make sure that we've got people on the ground doing things. We may just need to be, having a very innovative approach around how services are delivered in order to create the capacity to support other parts that require us to do so.
Thank you for that. I mean, obviously, do you know when we're likely to know when that exercise has completed in terms of what services are expected to prioritise?
So I think it'll be under constant review, and secondly, Sean wants to be able to give an update of where we've got to on that at the next cabinet meeting in November.
Okay. And are at the moment our services pretty much running as normal, or are there already pinch points in our services?
So we monitor our services on a weekly basis. Our gold group meets 3 times a week, which to some extent we probably don't need to have it meeting that often, but we think it's important that we set the tone for the organisation on that. Right now, we know that there is stretch, but nothing is breaking.
Okay.
Okay, I'm going to. We've got a list of people. So I've got Paul, Dan, Canty, and Jean. Jeff, your hand was up. Is it? Did you want to ask a question?
I have got a question.
Okay, I'll bring you in after Jean. So we'll start with Paul.
As co-optee on behalf of the wider community, can I just say thank you to all of you for all your hard work on behalf of the rest of us over the last few months and everything else and what have you. As we enter wave 2 and everything else and what have you, we've spoken about we've used the word resilience, We've also come across the notion through the slides that the organisation is only as good as its workforce and as good as its people. So therefore, what is being put in place for the well-being of the staff to ensure that the services are kept up to speed, that we do have the services that we need at the appropriate times, please.
Who wants to take that? I do have Tracy.
I could start, or
do you want to go first, Alex, and I'll pick up the second part of the question, really?
I can do, but it's also, I know Tracy's joined us this evening as well, so without suddenly just throwing her into the limelight, I think, you know, perhaps she might be in a better place to answer this in more detail. But I think first of all, Paul, thank you very much for the recognition of the work that the council's been doing over the first wave. I think the challenge here is understanding how we support the organisation and make sure that the support we put in place is the right support. We have a pulse survey, our second one since COVID, out in the field as we speak, which we've already got over 500 of our workforce responded to. And principally, one of the things that we want to try and engage from there is what are the needs and where are people at, given the fact that we're just at the start of this process. We've also done an assessment of all of our risk assessments that have been done. So individuals that have got concerns about their home working environment or their other working environment have been encouraged to do an individual risk assessment, and those have all been looked at by HR in order to understand whether or not we've got any pinch points in parts of the organisation or specifically in terms of home working and the like. So we're keeping it under constant review. I think we'll be in a better position to answer that question once we've got the results of the latest staff survey, our pulse survey, which will be out in the field until Monday of next week. And then we hope to have those results by the end of November in order to understand what that means and what interventions we need to be putting in place.
Can I just pick up?
Yeah, Graham. If Tracy, I'm not sure Tracy's on a call yet, so we'll go to Graham.
Yeah, the second part is we've over the last 10 years, our budget has been reduced and we've had to restructure a large number of services. And so we're actually a lot lower number of staff than we would have had sort of like 5 years ago. So we're not in a good place to take on a massive rise in demand of people approaching the council. And that's what I mean by resilience. So where before you had some flexibility and some leeway in some of the services, that's not there as much anymore. We're always continually looking to see how we can, well, people say to be more efficient, but I think it's doing things in a different way to try and reduce costs so we can actually keep the frontline services going. So that lack of resilience, that's why when I talk about lack of resilience, that's where I'm coming from. But it's just the point you also made, which Tracy about to answer, is around the staff have been under a lot of pressure over the last quite a few months. And a number of them, because we've been short of staff and we've had to maintain a set level of services, not enough people have had to take time off over the summer to sort of recharge the batteries sort of approach. And that's, I think, is a risk within the organisation, that people are tired and worn out. And we're going into something that people put a lot of time into the last phase of it all, 7 days a week, long hours, and trying to get some of that time back. We're now going into something that we've been told is going to last for at least 6 months. Right through the Christmas, through the winter pressure period, which is busy anyway, and that's where I'm coming from on staff. Staff welfare is a major concern, so there is some work being done on that, and Tracy's about to sort of go through that in some more detail than I could.
I mean, that's really my main concern.
Yeah, Tracy, and Elizabeth by Magic, Tracy has Tracy's come on the call. So Tracy, our Director of HR, I'm not sure if you heard the question. The question was specifically around staff and how we're doing to keep our staff, essentially morale up, make sure that our staff are resilient. All the additional pressures on them inevitably has an impact. So I wonder if you could just talk about what we're doing in your role as Director of HR.
Okay, thank you. What Alex started with in terms of our staff well-being survey is really important. We did the first one in May, June, to gauge where our staff were in terms of how they were coping with COVID, both practically in terms of the impact on them and their ability to feel able to do their jobs, but also the impact on them personally. And as has been said, we're repeating that in order to gauge the progress we hope that we've made, because at the point of the original survey, we didn't have the level of support in terms of IT, you know, to enable people to work effectively and to communicate with each other and their teams and their services in the way that we have now since the successful rollout of Microsoft Teams. So now our focus and our concern is to really ensure that people's well-being, their mental health, as they need to sustain themselves through the next phase of COVID, that is being addressed and supported. So we are about to launch a series of mental health awareness and wellbeing webinars, because it's been recognised that increased in, you know, personal anxiety, for example, will be affecting our staff just in the same way that we know it's increasing in the community at large. And we have a programme of support that will be available. We're also promoting awareness of other aspects of support, including for domestic abuse, because we also recognise that in the same way across the community, there's been an increase in instances of domestic abuse, that our staff will not be immune to that. And as many staff are also now in the position of working from home and being at home, if home life isn't safe and secure and calm, we want to try and reach out to those staff and also ensure that staff who are facing difficulties in terms of their personal circumstances know where that they can seek support formally. I think in addition to the personal risk assessments that Alex mentioned, we are actually looking at how well managers are able to communicate and support their staff who may be in the formally shielding categories. So, you know, staff who are falling within the shielding frame through age and underlying health conditions. And so far, what's actually quite interesting, we have about 60 staff who've needed additional kind of action plans to be developed with their managers. And what's interesting is that it's quite clear that managers are actually doing very well in reassuring their individual team members about how they can so safely return to work, making sure that they are familiar and comfortable and confident about the type of PPE and social distancing arrangements that are in place to make them safe at work. And we are also now looking at how we can work across the organisation to promote more social interaction through through Microsoft Teams and the other networks, so that some of that the more intangible and informal support and connections between members of staff that they would normally have had within the office, that some of that can be put onto the virtual platform. So, you know, coffee rooms, networks, you know, that are interested in different areas, whether that be craft to sport to social issues, just making sure that there is that opportunity, all the things to make to just help everyone to feel that they are still part of a community and network.
And as part of the staff management interaction, has there been a flattening of the management structure so that people can respond more quickly, so they feel that they can prioritise, get on with their work more quickly?
We will know that after the pulse survey. So because we do ask questions in the pulse survey about how people are feeling about the support and communication with, you know, with their managers and their teams. So the first survey suggested that was actually going quite well, and given, as I've said, how challenging the equipment was, as the communication tools were then, we would hope that has improved because Teams has made communication much more instant. So, but I would be able to say more definitively when we get the feedback through the pulse survey.
Thank you, Chair.
Great. Thank you. I'm going to bring in Kanti. I'm going to go Kanti and Dan, ask your questions, and we'll answer those together just to keep us along with Kanti.
Sure. Yes, thank you, Chair. So I've got some questions. So I don't know if Alex the best person. So one of the question was, I saw on this slide business continuity. So I just wanted to understand that a bit better, or what exactly it entails, and you know, in terms of the whole situation. My other question was that I know we mentioned surveys. I just wanted to understand what surveys we have made of residents' needs in terms of not just services and, you know, any other factors that we kind of also mentioning in relation to staff, for example, you know, what are their needs and what are their functions. And my final question was regarding, you know, in terms of the joint working and understanding by kind of taking all this feedback from various, you know, stakeholders. And my question specifically revolves around businesses. I know it's a balancing act, kind of getting all the, you know, the strategies right. But I think one of the concerns I've had, and I've had first-hand discussion with a lot of the businesses, you know, on Queensbury Circle, around Belmont, is the fact that, yes, we all know these barriers have created a lot of, you know, debate, but the specific evidence, and I know the council has gone out and given them surveys to fill out, which they've collected within 2 hours without actually confirming, you know, who would fill them out, whether return them. The point is, those businesses are suffering. They're not asking for handouts. They're asking for just for them to get on with it. There's problems delivering stuff because you cannot jump over the barriers. The forklifts don't go the barriers, and the same for delivering out because of economies of scale. Pallet delivery is the norm in or out. A lot of business affected, apart from the fact that it's not welcoming sight though when you see those. So it's not anecdotal. There's specific evidence, and my concern is, does the council feel it's really listening? Because the residents and the business are saying they're clearly not. They're not asking for handouts. So we just want to understand and, you know, make sure that's really clear and you know, heard actually.
Okay, I'm gonna ask Dan to ask questions, and we'll get those answers together. Dan.
I had two, but Paul expertly asked a version of my first one about staff well-being and resilience. But I just had a kind of a secondary question on that, just around annual leave and people's working patterns. So Graham mentioned that obviously want to commend our staff across the council for the work that they've done since March. But as Graham said, it hasn't really slowed down, and now we're moving into the second wave over the winter. Will there be kind of a way of managing staff taking time off? Is that not a possibility given the organisational resilience that's mentioned in the report? And if we could have that if we could have results of the survey and actions taken to this committee, that would be great, on the survey that Tracy mentioned. My second question was just to Alex around the testing capacity, which was a priority on the table that was showed earlier. Do we have any early results from the South Harrow walk-in centre? And is there any lesson? How is that being communicated within the borough to residents who could benefit from it? And will that learning be taken to a potential new site when it comes around?
Okay, so we have a number of questions there. Surveys. Who wants to take? I wonder if Alex wants to take a number of those, and then we'll farm the others out.
Yeah, I will do my best to go through each of
you,
them,
Alex.
and obviously those more expert can go into the detail. Just on business continuity, so we stress tested all of our business continuity plans back in March across all services to ensure we understood what would happen if we lost capacity, given the fact that we lost staff up to 10% or 20% on the basis that they had to be off work because of COVID. And of course, at that point, we didn't actually have the remote working through Teams and other rollout of IT, which has significantly enabled our capacity to be able to continue working at home where roles can do that sustainably. The bit around business continuity this time round is just understanding what would happen again if we lost 20% of capacity across our workforce in certain services on the basis of local outbreaks and the need to self-isolate and all those sorts of things. So it's a fairly similar scenario to last time, but obviously if we had to have a number of staff self-isolating, but they weren't in fact sick or ill, they would still be able to work from home if their job and the IT enabled them to do so. Whereas obviously if we've got jobs and roles which require to physically be in, be that in care homes, be that in the waste services, etc., then obviously the mitigations we'd need to look at are different as a result of how we would keep those services going. But those are live and ongoing at this moment in time to do those reviews. So hopefully that answers that question, Kanti. With regards to residents' needs, I think in terms of how we are trying to prioritise our services, I think as a resident-centric organisation, that's exactly what we're trying to do, on the basis that there are residents' needs which are COVID specific, and there are residents' needs which are more life and general in terms of their need. So obviously with those newer services, they are broadly around what happens if there is a COVID impact on their livelihood or on their lives, versus some of those other services which are continuing to provide services to some of our most vulnerable residents and ensuring that they continue to be able to be done at a good quality and a good impact throughout the remainder of this second wave. So from a resident perspective, I think you know the council has that at the foremost of its focus. With regards to low traffic neighbourhoods, I think I will perhaps sidestep that one because I think the leader perhaps may be in a better position to talk about where we are on those. But again, I'm very happy to cover those if needs be. On annual leave, we are encouraging people to take their annual leave, whereas I think in the first wave, we were quite conscious of the fact that we were in a proper emergency setting, working a 7-day week, and our capacity was stretched over there. And therefore, the summertime was a key point where we asked people to try and catch up and have some annual leave. But at this moment in time, we are not telling people that they can't have annual leave, principally on the basis that we need people not to fall over, and leave is very important in terms of a mitigation to make sure that people are at the maximum or the optimum of their productivity. It's pointless, you know, slogging people to the ground, and that's something that as a senior management team we're very, very clear on messaging around that. Just coming on to the testing capacity bit from Dan's question, I'll take that in reverse order in terms of the questions that he asked. So in terms of lessons learned, yes, we're applying those to the next sites that we do. In terms of the project management approach and all the people that we get together right from the start to ensure that we are slicker at identification, resident engagement and implementation of the site, and ensuring that we have absolutely made sure that the way that it is going to work is the optimum for the site and the optimum for local residents and those people visiting it. I may ask Lawrence just to give an update on what we've actually found going through the test centre, but on communications, we've certainly tried our best to make sure that people are fully aware of the fact that it is a walk-in centre. Appreciate at the end of the day, human behaviour is probably that people get in their car, drive as close to the thing as possible, and then walk to the centre from there. And again, one of the reasons for us putting it where it is that we know that there is car parking capacity just round the corner, if not necessarily at the actual site itself. But we've tried our best to make sure that the signage ensures that access is via the footpath from Northolt Road, and also the signage in terms of going behind the block is very clear from Northolt Road that parking isn't available. So I think I've covered all of the questions there. So happy to pause and others come in where needs be.
You have done amazingly well. Thank you, Alex. I am going to, on the low traffic, on Candy's point about low traffic neighbourhoods, particularly there was a particular point that Candy was making about surveys and data. It is something that I'm quite keen on, and the committee will be looking at that. Probably not this side of Christmas, but later on, a bit around how the council uses data and understands data. But Graham, if you do want to come in specifically, I think it wasn't low traffic neighbourhoods in general. It was the pedestrian space stuff that is impacting businesses, particularly that Candy was asking about.
Did Lawrence want to update any more around testing first?
Oh, yes.
A more wider point around testing than Lawrence was.
Okay, yes. Lawrence, do you?
Yes. Excuse me.
And welcome to Overview and Scrutiny.
Thank you very much. I didn't have particularly much to add on the testing issue. I haven't actually got the numbers for the South Harrow site yet. Obviously, it's just been commissioned. All I can say is that the testing capacity has increased. And I certainly anecdotally, I'm not receiving the reports that I was receiving a few weeks ago about people unable to get a test. Particularly, I'm referring to my conversations with schools and their staff. So I can just give you a flavour of some of those numbers. Back mid-September or so, there were 223 tests given for the Civic Centre site on a particular day, and as of Friday, that number's gone up to sort of 300. So I am being assured that the capacity for testing is much better than it was. And I'm happy to take any further questions, but I do apologise that we haven't actually got the numbers for the South Harrow site yet. As I say, it is very new.
Great. I hope if councillors do get regular updates at the end of the week, I wonder whether things like that can be added to the regular update. That might be helpful for specifically ward councillors in the area. But I'll take the nods as accepting of that point, and I'll bring Graham in.
Yeah, I'll just come back on that point across the wider scope of London on the call on Monday. Public Health England have said that the number of tests available has gone up, but the people aren't really going for tests on the weekend in some areas for some unknown reason. So they're communicating the availability of local testing, which was a barrier in the past. And there is still a delay sometimes within the not the testing itself, but the analysing of the data in the labs, and they're trying to resolve that. But we're still pushing to get the increased testing capacity across the geographical spread of London. So if you look at sort of like Edgware, there's one in Deansbrook Road, which is just sort of over the border in Barnet, but it's very close to the people who live in that geographical area. And I'll go back to Alex's point around it is a challenge in Harrow to find somewhere that's also sort of people accessible place that people can get to, parking and everything else that's involved if they go by car. But our priority is for people to be able to walk to them in the high areas where we believe that the virus is present, but people haven't yet been tested because they haven't been able to get to it. With the street, I won't talk about some of it, but on the ones outside the shops, I think that's every meeting I go to, this is sort of discussed. It was at the TARSAC meeting the other night as well. This came about through the funding stream direct from government, to encourage people to be able to go back to the high streets. We know from analysis across the whole country that people shopping in actual shops, physical shops, is much lower than it has been for a long time, because people haven't got that, still anxious in many places of going back. So this is sort of widening the pavement enough for people to pass each other in a sort of safe distance. And then we're sort of encouraging the shops to sort of make sure that people are having the proper sort of face masks and controls in place when they're in the shops, to encourage people back in. And that has been reviewed on a regular basis. A number of places have contacted us and wanted some minor adjustments. Quite a few, some businesses are very vocal about why they need it replaced. But some of them are saying, you know, but if we did it in a different way, you know, we could probably improve the situation for accessibility and about people turning up. All those are being considered. But I will go back to the point that when these came in, we had like 7 days to apply for the applications in the first place. And it was, if you didn't have them in time, then the money was sent back to the government. Then they took it back. We couldn't use it on other schemes. And so it was trying to be quite innovative to allow the wider spacing on some of the busy, narrower footpaths. So some places that have got a narrow footpath but are very quiet don't actually need that sort of extent of barriers in place. They're only there while the virus is at this level. And as we were saying earlier on, the rates are rising very rapidly and they're spreading because of contact with people coughing and spluttering as they're going along, and it's the close contact. So we're trying to give people that distance that they can pass each other without fear of believing they're going to be in contact with the virus. It is being continually reviewed. The next review is taking place, I think, this week on some of them, and there might be some recommendations come out of that to say that we need to make some amendments to some of the schemes. I don't know yet until they've actually analysed that data.
Great.
Can I ask a supplementary, Chair?
Candy, I'm conscious of time, so yes, you can, but if it's quick.
Yeah, it's quick. It's just. Sorry, leader. Yes, thank you for your response. I think the only point I would like to make is that, yes, we would like to go back to business and resident to say you actually are listening. I'm glad you're reviewing this, but I'm just saying that you've got to be fair to everyone, because the bigger businesses have no problem, like the Tesco's, the Morrisons, who are nearby. They've got their own parking slots. So obviously it's kind of unfairness that, you know, existing spaces are being, you know, restricted, so people can't go there. So they will opt to go to a bigger shop, a national chain store, because they've got their own parking. The Icelands, you know, the Tesco, the Aldi, all nearby. So it is important you listen. You mentioned Barnet or Edge or High Road. They have taken the barriers off, so they're listening to the businesses. So I think we've just got to be fair in Harrow, and we'll come and ask you again next time as well. And I hope we are talking a different discussion, because there's lots more to discuss rather than revisiting these spaces, because also the Transport Committee already said, leader, that they should be removed, but you kept them. So I'm just hoping you listen, leader. Thank you.
That was a rhetorical point, so I don't think we need an answer. The leader has said.
We have been listening to all this. We've had meetings around this than any other council. And Barnet, when they reviewed it, actually extended a lot of their schemes to make it right. If you look at Burnt Oak Broadway, they've extended it further. Sorry, we don't listen. I think it's a bit disingenuous.
I'm trying not to turn this committee into the TARSAC committee because it has been discussed thoroughly at TARSAC. So I'm going to bring in Jean. I'm going to bring in Jean and then Jeff.
Thank you. one was going to be on business and business continuity, but I think Canty's covered that one. Thank you. There is one, actually. I think I need to declare an interest anyway, non-pecuniary, around being chairman of Shaftesbury High School, because one of the questions I wanted to ask, which Joe Morgan's lead on, I think, is around schools, because yet again we had 3 more youngsters sent home, another member of staff from Shaftesbury, and that's not unique. And there are various ways that are being looked at, like having a double length half term and stuff like that. But in terms of being able to be as responsive as we can, what have we got in place in terms of procedures?
Okay, I'll bring in Jeff to ask his question, then we'll answer those two together.
Right. I had the question about sort of staff, but I think Graham and Dan's questions and Tracy have covered that. But what I'd like just make a comment on Canty's thing about low traffic zones. Actually, this is clearly subjective, but I've spoken to about a dozen people where I live, where we're in a low traffic zone. One person objected. All the others have been very positive, saying things like low pollution. We've got some long straight roads where the rat runners go very fast and people actually feel a lot safer, and you can see that, and there's more cycles about as well. So I think you're going to get a different response wherever you look, and we're just going to have to look at the survey information when it comes in.
Okay, was there another question you had generally, or was it just a response to Canty?
No, I had a question on staff, but that's already been covered by Tracy and Graham. Thank you.
Great.
Actually,
Okay.
I have a second question on homelessness. So am I going to be able
Go on, Jean, because I like you so much.
Oh, likewise. I was very lucky to have a very nice briefing with Paul Walker and Nick Powell and co. But Nick mentioned in particular the homelessness action board that's being set up. How is that being set up? I suspect Graham will be part of this. And what's the intention? What is going to happen? Because we know very, very well, as you've already alluded to, we're coming into the winter climate, which is going to be flu related as well. What's the thought about how that board is being set up, what its aims are briefly, but more importantly, how it can be effective?
Okay, schools and homelessness. I'm going to, Graham, I know you've got your hand up, so I'll bring you in, and then you can point to any officer you think might be able to help with another answer. Graham, you are still muted.
I was going to ask if Alex wants to go first, because he would know more around the schools. The schools are still quite independent around how they assess themselves, and they make judgments in accordance with the guidance that's been set out. They set up their own bubbles and make sure that they're in their sort of suitable, that they're not putting children at risk. The issue comes about is if the school decides they need to close to manage that risk, then they will do so. I know Shaftesbury's has more challenges than some other schools within the borough, and you know, and the children are more at risk of the virus if they contain it. I will say though, go back to a separate point. Although our infection rates are going up in the borough, our hospital admissions are still relatively low. So it's people with underlying health concerns. And that is the risk, I think, at Shaftesbury School, that if a child there came infected with COVID, it'd be harder for them to deal with it. But the schools are doing them continual assessments, and they've been supported by Paul Hewitt's team quite closely, so they can get advice. And they also report back into the Department of Education to make sure that they know they're following all that generous advice.
I did whether we might have a position if it came to a certain point around school closure. We don't have to have. I was just wondering if we did.
If the school said they have to close, then they will, and then we look at the family of schools to see if some can be moved into other school areas.
Okay, no, thank you. That's all I need to know on that one.
I wrote the question down.
Questions about homelessness.
Yeah, so homelessness is causing us a major problem because we've got the funding to take them off the streets and put them into secure into proper accommodation with a support wraparound there to try and make sure they can move on with their lives. That funding came towards an end, and we got some other funding through. So it's this uncertainty about funding. But our major concern is as the weather's getting colder. Normally we run the Churches Association, run the homeless shelter. And they can't be moved into there because you've got a high risk of the it's not COVID safe in that summary. We've also they've relaxed the rules on evictions, so we could end up with more homelessness there, although the evictions might be banned over this Christmas time, but that 2 weeks. It's not stopping other court access through the Section 6 arrangements rather than the Section 24 or 28, sorry. So 21. But it is a major concern. So what we're trying to do is there's been a significant increase in applications to the council around risk of homelessness as well as homelessness. So people turning up to the civic centre. And at the moment, they've been able to put a plan in place to try and cope with that, to make sure that people can put in emergency accommodation in a safe COVID tested environment. We have a new service manager who's dealing with housing needs, and they developed a plan. Beatrice. Yeah, and Beatrice has put the plan together to try and bring all the services together and to come up with some other innovative ideas. The problem we face is we do not have the affordable housing in Harrow that we can put a lot of people into. Now the rents are quite high and outside of the benefit level, so there is a strain in that area as well. The panel that's been brought together is trying to manage that because we got the fear of the winter cold weather through homelessness. We've got the threat of evictions area. We've got the area around people from about mental health, where the family breakdown and domestic violence, so people are having to move out of the environment and trying to find them. But also we couldn't take into consideration the benefit changes next March, which will also have an impact whether people can afford to pay the rent or not. And then on top of all that, the furlough scheme finishes this month. The threat of a tier 3 when it could reduce people's income down from November if they're on self-employed or low income. It's also another thing we've got to take into consideration where people can't afford their rent, and that could be one of the reasons why they move into the eviction notice is being issued. So all of that is being done through the board that Walker's advised you of. Okay,
I think just on the point, it would be good for us to have an update. I'll get one anyway through Paul Walker. But it would be useful for the board to, for the committee to look at this again as part of it, because as you rightly say, Graham, things are shifting all the time and various external factors, if you like to call it that. So we have to respond to that. So it'd be good to be kept up to date. Thank you.
We certainly picked that up through the leadership group. Jeff, you had a question. Jeff, you're muted.
Sorry. Yeah, just on the homelessness issue, do we have any figures at all as to how many have been homeless during this period of lockdown? Because I certainly know certain areas in my ward where people have been living rough, and the police have intervened and they've come back, but those people have actually been homeless during this period. So I just wondered if we had any figures for people still in that situation.
And Alex has put his hand up, so hopefully he has the answer.
The answer is yes. I think during the main lockdown, numbers stayed pretty static. Obviously, in September, which were the last numbers I said, there was a starting of a rise. But we can get those latest figures to the committee. That's not a problem at all. The one thing I'd just add in terms of our response is that it's multi-agency, and this new board will involve all the partners that we need to do to get the right early intervention response on homelessness.
Yeah.
Great.
Okay. So just following on from that, do we know how many of those people would have mental health or some other issue where they would be refusing what help they were being offered?
So we have that data now broken down on ethnicity. We have that data broken down in terms of other conditions such as mental health. So I can have a conversation with Paul, Nick, and Beatrice to see what information package we can pull together for the committee's benefit.
Okay, then, thank you.
Great, thank you. I don't see any other hands up on this item. If you do want to say anything, you just want to unmute yourself and say something. Otherwise, I'm going to move us on. No, okay, thank you very much. That was that we thank you very much for the presentation. I do want to, just before we finish, just to highlight, because often when councillors come in contact with officers, it's to complain about something that's gone wrong, and it's quite heartening to see the number of councillors that wanted to ask questions specifically about the well-being of staff. So I think that's quite telling. Although often it sounds like councillors are just moaning at officers. It isn't the case, and as you can tell by the committee, many are continue to have concerns for staff welfare. So on that point, I'm going to move us on to item 8. So we have a presentation around equalities and borough plan, item 8 and 9, but I'm going to take item 9 first on equalities because it's an important precursor to the work on the borough plan, so it makes sense to focus on equalities first, which I think is around halfway along Alex's presentation. So sure. Alex, if we do equalities and then we take questions on that, and then we'll come back to the borough plan.
I mean, I can whiz through the borough plan bits in about 30 seconds if that's helpful, Sachin, in terms of and then moving on to equalities if that's helpful.
Okay, well, yeah, let's do that then. Yeah.
So in terms of the strategic overview of these set of slides that again was circulated beforehand, it's around the next steps on the borough plan and the changes to the borough plan, which are as a result of our response to Black Lives Matter and the broader equalities agenda. And then it moves into more detail around the activity related to Black Lives Matter. So next steps on the borough plan, broadly, what we are doing is recommending to Cabinet in November that we introduce a new recommendation, which is a cross-cutting priority around tackling racial disproportionality to take account of our Black Lives Matter response, and therefore start setting out how the actions within the borough plan, when we deliver or develop the council delivery plan, will then be set out as well within our response to Black Lives Matter and equalities in general. So from that perspective, those are the changes that we'll be making to the borough plan. This next slide just gives an overview of some of the things that we've done to bring the borough plan forward since its agreement in February, just on the basis that it hasn't just been static since then. The only thing we've paused is the engagement around the borough plan. And then moving on more specifically to the update around Black Lives Matter. So in effect, our response is threefold to this. And I'll ask other colleagues to come in as well where necessary in all of this. So I'll just cover the overview to some extent. So we've looked at it in terms of inequality and life outcomes, and principally that's where we are recommending around a change to the borough plan on the basis that we needed to think more deeply about what this meant rather than necessarily just wordsmithing and changing a document in that way. So it's a fundamental change to the way that we're approaching our priorities as a borough and making sure that racial disproportionality is something much more central to how we view our services. Linked to that is a review of our services, and we'll be looking at a number of areas where actually, and homelessness is an interesting one given the fact that we have a population broadly in Harrow around 8% from a black heritage, and just under 30% of those families that are presenting as homeless come from a black heritage background. So it's quite clear that there is disproportionality in terms of those outcomes that people from black heritage are experiencing in Harrow, coming through to some of our more critical services and services such as homelessness. And then the next one is around our action as an employer and how we intend to take that forward. And Tracy will be much better placed to go into the detail when we come onto that slide. So moving on to more of the detail around the things that we have done across each of these 3 streams. So in terms of the inequality in life outcomes, as I said before, we are making or recommending to Cabinet and then on to Council a change to our borough plan on the basis of the importance of this agenda and making sure that it's a more fundamental change to that. The Chief Executive is our sponsor on race, so we have that senior appointment to do that. We've also Shamila Dar, who is also on the call this evening, is a temporary appointment towards a senior policy officer around equalities, which at this moment in time is a 6-month secondment, which started a couple of months ago. And also we've established a cross-party members group, which has met a couple of times already, in order to make sure that we have got the most appropriate response on this and that there is member oversight. And Varsha, who is chair of that committee or cross-party members group, is on the call this evening as well. And we're also reviewing our equalities governance to make sure that we've got the right thing in place. And that also includes how we look at our EDI, our Equalities, Diversity and Inclusion framework to develop our action plan. And we've also had some initial discussion with the voluntary and community sector. There are a number of things already going on around things like violence, vulnerability and exploitation, where we know that there is a disproportionate representation from people from a black and minority ethnic background known to our services and known to the voluntary sector. And they're already starting work on that. And what we want to try and do is make sure that we engage more broadly with the voluntary sector so that we've got all the right people represented around a more strategic approach to that agenda. In terms of our review of our services, we intend to make sure that we look at a service review framework which will help us understand the impact that we need to make on our services so that fundamentally they improve from the disproportionate impact where that is evidenced. So we want to look at areas where we've got the data telling us that there is already a disproportionate impact, and we know areas like our youth offending team, we know areas like our homelessness services are already seeing those disproportionate impacts. So the question is how we review them and review them effectively so that we improve them, and also need to take account of how we do that during COVID, when obviously capacity is stretched and also the staff working in those areas are stretched, as we've discussed on the previous item. So we need to come up with how we do service review working groups in order to ensure that we do that well and we do that right. We're also looking at how we can set targets over our action plan over the coming year. And of course, when we first put this item and also the borough plan on the overview and scrutiny agenda, I think we did that thinking that we wouldn't necessarily be in the COVID level of emergency that we're in currently. So that's why we've suspended the development of the council delivery plan so we can respond to the COVID emergency. And also in terms of moving this agenda forward, although we've made some significant progress, we are not yet in a position to bring the overall action plan through to scrutiny and through to cabinet. However, we did think it was still important to make sure that we gave you an update, both the scrutiny and our reports going to cabinet in November, to set out what we are able to do and how we're able to do that. So I will hand over to Tracy at this point to talk in a bit more detail around the action as an employer.
Thank you, Alex and Chair. The action and our activities as an employer are a key part of the approach to Black Lives Matter, and obviously for our workforce, this is where the aim is to ensure that we can really demonstrate how we are actively improving outcomes for our staff, with a view to ensuring that our outcomes for our residents also reflect our progress in terms of race equality within the workplace. We've started quite boldly by appointing an independent advisor, and this is is someone who hopefully will be known to many of the members, and that's Patrick Vernon, OBE, who is a lead campaigner on Equalities. It's recently published a new book called 100 Great Black Britons, and is very well associated with the Windrush campaign, and also formerly director of the Black Mental Health Improvement Organisation and campaign known as Black Thrive. So the Patrick's role will be to work with all staff, all stakeholders, and members to develop a view of the perspectives and experiences, with a real focus on the lived and working lives of all of our staff in relation to the agenda that has been raised through Black Lives Matters. And the aim is that he will undertake this engagement, which he has already started with staff and senior managers, in order to develop some recommendations, which of course will be considered by this committee and the cabinet. We have started work now by committing to the Race at Work Charter, which is a national campaign led by business in the community organisation, and the Race at Work Charter is basically a commitment to develop five principles with a view to improving outcomes and experiences and career development and progress for Black, Asian and multi-ethnic staff. The launch of the Black Lives Matter staff group, which emerged very early in the staff response to Black Lives Matter, has been encouraged and endorsed, actively endorsed and sponsored by the Chief Executive, and as mentioned in the slides, includes members of the initial committee undertaking reverse mentoring for senior managers on the corporate strategic board, and taking a lead role in a series of lectures and events as part of Black History Month. And I understand that there are some very key seminars taking place, including the speaker, Stuart Lawrence, the brother of Stephen Lawrence, is going to be doing a keynote lecture, and all of this is under the auspices of the Black Lives Matter staff group. And what's been very important is that the Black Lives Matter staff group have encouraged participation not only for Black staff and our BME staff, but are encouraging participation and dialogue around race equality issues for across the workforce, and are encouraging white and non-BME staff to take part confidently in this dialogue and this learning opportunity. there's a strong focus on ensuring that our response to Black Lives Matter is part of our overall response and approach to equalities, diversity and inclusion, and ensuring that this is based on evidence. So we are looking very closely at our equalities data to ensure that we understand the profile in relation to the pay and grading differentials in terms of race and ethnicity, as well as gender and disability, and that we understand our trends in recruitment, because of course it's very important that we can be confident that there is a fairness in the application of our recruitment processes for all jobs and at all levels of the organisation. In order to understand the evidence around our equality performance, we will be using not just the static data in terms of, as I said, where people sit in the structure, but we will also be utilising the opportunity of a race at work survey towards the end of Black History Month. Again, this will be a survey of all staff, and we also want to look at ensure we're able to incorporate some of our more recent leavers to see what their experience and understanding is of how the Black Lives Matter and race equality agenda applies to them in their own experience of working for Harrow. And just to emphasise the fact that we are trying to balance the work we do by providing some immediate opportunities for staff. We have launched the Business in the Community mentoring program, which allows BME staff to be involved in mentoring and networking circles with other organisations, and there are currently over 30 different organisations, including some other London boroughs, that are participating in that programme, and that's really fits with the fact that we know that Black, Asian and multi-ethnic staff are much more likely to be looking for mentoring and career development opportunities and support as key to progressing their careers.
Thank you, Tracy. That was a really good summary of all the work that's done. I know that Varsha is on the call. Varsha is the cabinet member responsible. I wonder can bring Varsha in now to see if you'd like to add anything to that presentation.
Thank you, Chair, and thank you for inviting me to this meeting. Not a lot to add to what Tracy has said, but as a chair of the members group, which is a cross-party group, what we are doing is looking at the third strand, which is the one that Tracy has been speaking about. Internally as a council, how do we improve for our work staff, and how do we improve the training, the recruitment process, etc. And Patrick is also obviously is going to help us with his work that he's doing. What we've done is we've had one meeting already, and the way we're moving it is that we will look at what the council is doing. We will give our input because we're kind of an advisory panel. And what we've also done is had one-to-ones. So Alex has spoken to the members one-to-one as plus the meeting, in order that we capture everyone's input in what they think should be done, etc. I've also spoken to the council group, the Black Lives Matter group, which it's been very good. They've got a lot of positives there that, you know, want to do the right thing. That and, you know, the group is open to everyone, as Tracy has said, and they listen to everyone. You can do one-to-ones, they do counselling. They've organised the Black History Month webinars, etc. And they've got some really good speakers. Patrick was one of them, obviously Steve Lawrence's brother, and he's a fantastic speaker. So, and it's open to everyone to participate. As a members group, although we may have members, I've always said that if anyone else outside had any thing that they wanted to email me on, then I would be quite happy to take those ideas forward as well, in order that we ensure that all members feel that their voice has been heard. You know, we're at the beginning of this, but if we look at that, the motion went through in July, and what we have done so far with the emergency as well, I think we have done quite a lot. And obviously, as Tracy, Alex have said, there is a lot to be done, and we are having monthly meetings. And, you know, I update Graham. Graham is also working with me alongside, as he is the corporate person in charge, and Sean as well. He is the CEO and the senior person in charge. So we're all working together. We have a common purpose. And what we had decided is that we will work with Tracy and everyone on the council side of it, because we think that's where we can make the biggest impact, because what we need to get ourselves organised and sorted out before we can take it out to our residents. And that is all happening. All the areas in the council is working cross council, and we are all looking at things, how we can do it differently, how we can make everyone feel inclusive and part of the conversation. So I would say to anyone here as well, that if there is anything you want to send me an email on, something that you may think might be useful for me to know, that we can discuss and bring forward, then please do that. Like I said, lots to be done, but early days. So, you know, we're all working at it. So thank you for that, Chair.
Great. Thank you, Varsha. I see Jean's got her hand up, so we'll start with Jean.
Thank you, Varsha, and also thank you very much, Tracy. It was good to see you in action, a fellow CIPD person, I'm sure. I was very interested in the webinars of the Black Lives Matter group, staff group. I actually sat in on the one with Patrick Vernon, and although he started off a little slowly, he really did get to grips with the sort of things that people want to talk about and look at, and also, very importantly for me, put it into a bit of perspective in terms of how the staff might be viewing things, because there is a temptation to have a lot of negativity around what we're doing. It shouldn't be. It should be a very positive process. So we've got Rob Neal this week, who's a very good friend of mine and a wonderful Minister of Justice man, so he's good. But my question really is that obviously the staff group is taking the lead, which is brilliant. How did the general staff who signed up, because there were lots, sign up to the first webinar that Patrick did?
Did you? Sorry, are you?
Yeah.
Tracy, yeah.
Yes, sure. Yeah, we'll take the questions as they go at the moment.
The feedback that the group have received has been really, really positive and quite exciting. And I was actually on leave. I was taking my first week leave since joining that week, so I missed it. But I know Patrick very, very well. But the feedback has been excellent, and I think there were 160 people that signed up for the event, and again the feedback from the staff group, both the Black Lives Matter group and the Making a Difference group, is that was a really, really positive response. And I think that's continuing. There was a meeting this morning of the group a discussion, and one of the things that was interesting there was that there was clearly lots of participation from non-BME staff who was asking questions about how they can get involved, how they can support, and looking at the the term now is what it means to be an ally. So I think all the signs are really positive in terms of the direction, and I think also meeting head on some of the challenges, i.e., how do you make Black Lives Matter an inclusive process? I think that conversation isn't being shirked, and I think that's really important, that people feel empowered to take part, even if they don't come under that the banner of Black or BME.
Absolutely. What was the other group you mentioned? Positive.
The other group is Making a Difference.
Making a Difference.
Yes.
How do they fit in?
They are the general staff forum in Harrow, and they precede Black Lives Matter, and they have been involved in organising diversity and equality events, I think, for many years, and that's everything from previous Black History Month, International Women's Day. I think I joined just after International Women's Day, and there was an event that week that Madge were hosting. It was just before lockdown, obviously. Yeah. And they've also been actively involved in our work on the Stonewall Equality Index, which Harrow's been committed to for some time.
It's good to know they're working together. Perhaps more about that another time when you've had a bit more to see how things are going. But that sounds very positive to me, because I was one of the people who did the motion, and it sounds to me like the way it's being extrapolated through the engagement process is a positive engagement. Thank you.
Fantastic. Are there any other questions that people have? If not, one of the things that Harrow has struggled with for the 10 years that I've been a councillor, at least the 10 years that I've been a councillor, probably longer, is around senior staff, ethnic minority staff. So Tracy, in the time that you've been here, 6 months, I've never quite understood why it's the case, because other councils do a lot better than Harrow. Have you looked at this and understood what it is that Harrow, is there something in the way that Harrow operates that makes this a problem?
I'd love to say that I've worked it out already, but no, that's probably in the next 6 months. So no, I'm not sure. I'm not sure yet what the distinctive issues may be for Harrow, but I have to say, I came here from Lambeth and was very much focused on its OD and its equalities agenda for my 2 years there. And in fact, Lambeth were in their senior management profile was exactly the same as Harrow's is, when we started. I'm very proud of the fact that actually I left it in a completely different position, going from I think something like 8% of the top managers being BAME, which was actually just one person effectively, to a third of the senior management team being me when I left. So I think there is much you can do, but you cannot do it overnight, and we're on the journey, but all the indicators are good. And Harrow's underlying position beneath the very top is actually possibly more progressive than Lambeth. So if you look at the profile of our management grades more generally, apart from the very top.
Right, that's really positive. So I think having that experience that you've had from Lambeth, I think will be really useful in Harrow. I can't see any indications, so I'm going to ask another question, just around the particular issue about Black Lives Matter versus ethnic minority. So we heard earlier around homelessness and the real issue around the disproportionate impact it is having on Black communities in Harrow. I think the numbers were 30% versus 8% of the population. We as a committee have looked into, we had a discussion with the police a few months back, and the statistics in Harrow were that, I mean, if you're Black, you are substantially more likely to be stopped and searched, but if you are Asian, you are less likely than a white person in Harrow to be stopped and searched. So there's a particular issue we know about substantial impacts, disproportionate impacts on the Black community. And in your presentation, there was a lot of Black and ethnic minority in mixture, where are you worried that we might dilute the issue? This is Black Lives Matter, it's not ethnic minority lives matter. Are you worried that we might start diluting the problem?
No, I'm not worried, because the focus on Black lives, on ensuring that we're looking at the experiences and outcomes for Black staff, underpins the whole approach. So, for example, we're not today talking about our data in detail. However, the meetings where we will be looking at the actual staffing profile, we are separating out by ethnicity. So we will be able to look at Black ethnicity as well as Asian, as well as at the moment the categories of mixed, that's mixed Asian, mixed white, Black, etc. And you're absolutely right that this can make a dramatic difference. I don't have the statistics at my fingertips. However, one of the sort of early signals around the different issues in terms of race is that we know that black staff are disproportionately represented in the lower grades of the organisation, and that's compared to Asian and mixed race staff and white staff. So we are looking at that. And in terms of the ethnicity pay gap, the recommendation in terms of how that should be approached, both from the Government Equality Office and the Race at Work Charter, is that it is essential that that is looked at in terms of different ethnicities. And for example, if you nationally, it's recognised that if you look at Bangladeshi as a category, their pay gap is often the most the largest, shall we say, compared to other ethnicities, and Black ethnicities will also have a significantly larger pay gap on average than Asian groups. So we will be looking at that, and as I said earlier, I think the need to confront this head on has been addressed by the Black Lives Matter staff group with other staff, and I think actually it is that evidence, isn't it, that allows you to demonstrate why it is important that we focus on Black Lives Matter, because if the evidence about outcomes and experience is telling us that there's a difference in terms of how sometimes how institutional, systemic and structural discrimination affects different ethnic groups.
Fantastic, great. Thank you very much for that. Really great answer. I'm really glad of the answer. I'm very happy. Are there any other questions or comments on Equalities, Black Lives Matter? No, in which case we quickly skipped over.
I wait. Sorry.
Oh, Jean. Sorry. Yes, Jean. Please. Yeah, please.
Hopefully a very quick question. We've had for many years at the end of a document that's come to Cabinet or Council, Equalities impact, and it's been assessed as Equalities impact. Are we reviewing what that means? It's probably a quickie really for Tracy. And how are we going to review that so we measure the proper Equalities impact of any policy that we make?
Alex, you can jump in if I get this wrong, but the need for meaningful equality impact assessments has been identified as top of the agenda for the equalities subgroup, and so we will be looking at what changes need to be made in order for equality impact assessments to have real benefit. And I think one of the things we said is that we need to go back to the basics as to, rather than seeing it as a tick box exercise, recognising that the reason why we do equality impact assessments is in order to identify if there, basically to identify equality implications of different courses of action and behaviour, and hopefully to put us in a position where we can make decisions which improve outcomes rather than just justifying justifying what we have done or felt that we need to do.
Alex, is there any more to
that? Tracy, when's it will be introduced?
This is a work in progress, and in terms of that, and in terms of the proposals that will be going to Cabinet next month, this is the kind of specific area which we will be putting into the action plan, because it's not something that you can just do overnight, but we are suggesting that we prioritise looking at restructures from an internal point of view, and EIA is there to pilot a better way and a more meaningful way of doing them.
Great, thank you very much.
Great. Kanti.
Yes, hi, Chair. If I could just follow up what Jean said. She asked a very good question, because I think one of the things we always see is equality's impact on every piece of document that we review for meetings and for other purposes. So I think we always wonder what's entailed in the process. For the sake of everyone's awareness and knowledge, and mine especially, is it possible to get some kind of overview or checklist to say what is actually looked at, so for us to understand, and also to understand in terms of the process of what's going to change going forward? I think it'd be useful awareness tool for us to understand that, if there is such a thing.
Okay, I'm going to hand over to Alex and his expertise on that.
No, I wouldn't necessarily go that far, Tracy, but I will certainly do my best. So Kanti, yes, we do have a framework for equality impact assessments. We have had for many years. That's been honed over the time to try and make it more effective. I think, just building on what Tracy said, the key here is having equality implications at the heart of and at the front of any changes or improvements that as a local authority we want to make, rather than having them at the end of a process where actually all they become is a tick box. Very happy that we share the framework for our equality impact assessments, but I think part of what we need to achieve here is a cultural shift rather than necessarily a process shift.
Great, thank you, Alex.
Thank you.
Are there any other questions? Before we close, I'm going to jump backwards now to Borough Plan, and then we can sum up these items together. We've already had Alex's presentation. I can see Antonio is on the call. Antonio is the political lead for the Borough Plan, and he's popped up on my screen now. Fantastic. Antonio, Alex has given us a brief update on what the changes are to the Borough Plan. Is there anything you'd like to add to that?
Thanks, Sachin. So I think it's just to reinforce the earlier, I guess, how this all flows together. So from the earlier presentation about the implications of COVID and the need for prioritisation, I think that clearly is informed how we have somewhat had to change plans for the Borough Plan. And the most material aspect of that is in the stepping back from the engagement and consultation piece. But what we wanted to stress was that as a framework for thinking about how we deliver and prioritise improvements. Sorry, somebody should be asleep but isn't, so apologies if you hear that in the background. It remains very powerful, and clearly a huge amount of work is ongoing. But as Tracy and others have shown, we've also had to change it as we've learned more about ourselves as a place and an organisation. And so it remains a very, very important vehicle for delivery. But clearly there have been some delays to the original plan as a result of COVID, which I think, well, obviously very happy to take questions on, but is clearly, we feel pragmatic and sensible given the circumstances.
Great, thank you, Antonio. Are there any questions on the Borough Plan to Antonio or to officers? Yes, Canty.
Just a quick one, Chair. In case I've understood this correct, so in terms of I know one of the items on today's agenda was that the incorporation of the COVID response to borough plans forward. So have you got any idea when this might become more specific into what it's going to entail in terms of changing of plans or regeneration, so on, in terms of incorporating our findings and the comments of the COVID, especially in every respect, health, living, open spaces, welfare, and so on and so forth.
Thanks, Canty. So I think, as Alex set out, there'll be an update at the next cabinet meeting in November on more specificity, and specifically on the council, effectively on the delivery plan, which was meant to be the 2-year specifics of objectives that will be delivered in a shorter time frame rather than the original 10-year horizon. I think COVID clearly will have a huge impact and role to play on that. I think, frankly, there is a danger that we sort of either underestimate or overestimate what the impact of COVID will be. So there'll be a degree of agility and flexibility required, but we anticipate at that next iteration of the delivery plan we'll go into more detail there. Alex, I see your hand up, but yeah, feel free to jump.
Thanks, Antonio. Yes, just to build on that, I think this comes right back to the previous discussion, or our first discussion this evening. We need to prioritise as an organisation how we take account of all of the things that we've got to deliver under COVID and keep the show on the road with our existing services. And this is going to be really quite tricky and has to be our immediate priority. So although we have a borough plan, and although we are delivering against the borough plan on a number of different things, how we take that forward in terms of a council delivery plan at this moment in time, I think it is fair to say to the committee, we don't know when we are able to do that work. But in terms of how we would incorporate the learning from COVID, part of that needs to be get into a position where we have fully understood the impact of COVID. I think it comes back to Antonio's point around we shouldn't over or underestimate that at this moment in time. However, we are an organisation that's responsible for a significant amount of services, and we need to prioritise being able to deliver those well and as best as possible over the coming months and the coming second wave.
Great, thank you. Are there any other questions? No, I think going back and thinking about the discussions this committee had about the borough plan when it first came, it was January, February, before we were into understanding the pandemics. One of the things that the committee was quite strong in our recommendations was around prioritization and showing the fact that if you reduce your priorities to one, you actually manage to do it quite well. And I wonder, I think COVID has shown that to be true, because what the council did do from March is throw everything to one side and say, well, our focus is on getting through this pandemic, and we've done that as a council very well. So I think that the committee was suggested that there was a way forward, and I think the COVID has shown that to be quite effective. And so I'd go back to some of the points we made earlier. We've still got in the trapezium the eight areas. I still have concerns that is far too many, and I think the experience of the council over the last 8 months has shown when we do prioritise on one area, we can do it really well, which we have done in COVID. I think that's just a more general point. And well, Alex, as you've got your hand up, Alex.
So I think it's an agreement with you in part, Chair, on the basis that I think we have been able to take forward, even through the pandemic in its first wave, things which have added value to each of those 8 priorities. And I think that one slide that that was in the presentation pack tries to do that. However, I think you are absolutely right in terms of we can take certain things forward a certain length of way. However, we can't do everything. And I guess the one thing that COVID will do is, so for instance, previously we were thinking about retaining economic growth in the way that we were doing. Obviously, the impact of COVID is going to change that and turn it on its head. So how we change our approach to that priority will be critical. And that will be something that we obviously do as an organisation and do with partners. Health integration has accelerated as a result of COVID, and our partnership with our health agencies locally has never, ever been in a better place. And in the 11 years I've been here, it certainly hasn't. And if it precedes that, then it kind of precedes anything. So from that perspective, certain things have been enabled by the pandemic, and we've taken and seized the opportunities to drive improvements and drive integration where we can. Other things obviously have taken more of a back burner, and obviously we'll review those in time, given when we know we're out of the pandemic and we're able to start getting to some form of whatever business as usual looks like, whenever business as usual comes back to whatever form it comes back to.
Great, thank you. Are there any other questions or comments? I don't see anything. My notes here says chair to summarise any outcomes. I think I over the two, the borough plan and equalities, I think I will sum up in saying we've had a really good discussion. I think the committee broadly, there hasn't been any, this is an outrageous way of doing things. So I think the committee broadly thinks the council is on the right tracks. I think certainly on the issue around equality and how it links in with the borough plan, more detail is required, but I think we all accept that there have been other priorities. The reason why that hasn't come, but we look forward to seeing that through cabinet, full council, and then back to this committee at some point over the next few months. And then it is a 10-year document, so no doubt this will come back some point in the next decade, hopefully regularly over the next decade, as we see the document to fruition. And I think on that note, on that summary, I'm going to thank everyone that's come for that part of the item, and I'm going to move us on to item 10, which is the refreshed scrutiny work programme. I don't think we need a presentation on this, so I think it can be taken as read. It has been between myself and Stephen as vice chair. We have gone through it and taken on board the comments of the scrutiny leadership team. I do recognise that there are members of this committee that aren't necessarily on the scrutiny leadership team. So if there are particular areas that people would like to see come to the committee, do let me know or Stephen know, and we're happy to bring that back through the process scrutiny leadership team and get it onto the agenda item. I'll get it onto the plan. On that, can we approve the recommendations on the agenda to agree the plan? Is that agreed? Yes, agreed. Fantastic. Item 11 is the scrutiny annual report, and I think it's worth spending a bit of time on this. There's sorry, the way I've got my screen, it looked like Jean and Jeff were talking to each other, but obviously not, because you are in different rooms, but you just happen to be leaning towards each other at the same time. Scrutiny annual report. This has been something that has this report this time is substantially different and substantially improved from previous occasions, and I do want to thank officers for all the work that's been put into refreshing this. Richard, our former vice chair, is one of the thousands of people listening on the live stream at the moment, and he's just sent me an email, and he says, could you please pass on my thanks to everyone involved in producing this new style annual report? It's a big improvement on what we've had before, and I hope it will be built on in subsequent years. And I absolutely do want to echo that point. The way that this report has been dealt with in the past is very much a tick box exercise. A few pages on what's happened over the last year. No real detail, no real understanding of the outcomes. This time, officers in the comms team, in Alex's teams, and in other areas as well, have spent a lot of time interviews with different leads and others to come up with a new style which will make its way off to full council at some point. And I think it really shows the real added value that scrutiny can have. You know, often, and I've seen it as a cabinet member and leader, often scrutiny can be seen as something that has to be dealt with rather than something that can add value. And I hope this report will show the value added that scrutiny can bring. I see Jean. I'll bring Jean in.
Thank you, Sachin. I want to echo that because I was the, if you like, the active member of scrutiny as well to enable this change. And I do have a background in writing things. And the one thing that I asked for them to do was to make it more meaningful for anyone who might pick it up. In other words, you know, you don't have to, I must go and look at the scrutiny report. You see it, you think, oh, well, that looks interesting. Oh, that says something about homelessness or whatever it might be. And I think the way that it was basically Emma, it was Daniel before, and then Emma came in, was very helpful, and Helen. And the idea of doing colleagues, including myself and Kazanfa, was both amazing, but also really quite scary. And I think it made some of our scrutiny leads very on the front foot about how they thought about what they were doing. And so it puts it into a sharp perspective. And I have to kind of congratulate comms for pulling that out of the hat. It was a really big ask at the time, but it became the right way to do it. And I'm personally very pleased with it and commend it to the committee. Thank you.
Great. Are there any other comments or questions? No. Okay, the recommendations are that the Overview and Scrutiny Committee consider and agree the Scrutiny Annual Report 2019-20, and we submit the report to full council for endorsement. Is that agreed? Agreed.
Agreed.
Fantastic, thank you. And move on to any other items. None have been notified. So on that note, I'll draw the meeting to a close, and can I thank everyone for attending, everyone for being a member and participating, and I close the meeting at 8:34. Good night, everyone.